I am Dr. Shomitra Dotto. I'm a senior pediatric consultant based at Bhagirathi Neotia multi-speciality unit at Newtown, Kolkata. I'm privileged to have with me a good friend and a colleague of mine, Dr. Shubhamoy Das, who is a renowned pediatric gastroenterologist who is working with us. And, we will be discussing today about a problem which is not that infrequent. It is ingestion of foreign body, especially in children, and we are faced with it pretty commonly.
Thank you, sir, for your kind introduction. So, as sir has already set the ball rolling, so as we know that pediatric or foreign body ingestion even in adults are not very infrequent or not uncommon, and they are usually an emergency, especially for the parents and also for the hospital authority or the staff, how to manage them, what will be the approach. So if we just go by the data, so there is some Western data. I found some in the 2019, 2016, the serial data. So it's about 1 lakh cases per year in USA, and we also published one data in ACG about the foreign body from one of the tertiary care center which I was working at that time. So at least 100 to 200 foreign bodies may land up in the pediatric emergency or in the OPD. So I will just ask sir, how frequent you have faced that a call from the emergency about a foreign body ingestion in a child, because you are the first person who will get the call from the emergency or from the hospital.
That's true. I mean, it's not infrequent, but we get a lot between the ages of, practically between the ages of 6 months to 6 years, but it's mostly between 1 to 3 years of age. Sort of children picking up things and just swallowing it, with being noticed by their parents and carers, or may not be. So they sometimes are asymptomatic, and sometimes people do release that something is lost, and then they get panic and really try to think whether they have ingested. Also, there are certain instances when the parents actually see the children sort of ingesting something, and we see a lot of coins. Coins are the most common.
Yes.
We even see things like the watch magnets that we use nowadays.
Yes.
Magnets, and they are pretty catastrophic. So magnets, even sharp objects like even needles, blades, you can't even imagine how much that we see, but we really do see lots of things nowadays. We see a lot of plastic bits and pieces of toys, even that we see. Yes, we do see quite a lot, actually.
Yes.
To be honest.
Yes. So as sir was explaining, that we usually categorize them as sharp and non-sharp when I get a call. So sharp, always an emergency. Among the non-sharp, fewer emergency which should be dealt either by an intervention intervention or something else. I mean, even a surgeon may be in the picture. So these non-sharp foreign bodies can level like coins, which can remain in the food pipe, in the stomach, or may have crossed it. Button batteries are emergency. Button batteries because they can cause significant damage to the mucosa and even early perforation if they are in the esophagus or the food pipe for even 2 to 4 hours. And definitely magnets, and especially if it is a dual or a triple, multiple magnets, they are also a medical emergency and should be dealt at an emergency. So, when you get a call, what you likely ask for? I mean, what investigation which is most important to you? Because after you deal with that, then we get a call that what to be done, or whether this child should either land into the endoscopy room or we should wait. So what are the investigations?
The presentation is very varied. Actually, sometimes there's a definite history of ingestion. Sometimes there's an indefinite history of ingestion. And sometimes the patients are symptomatic, and sometimes, which is actually luckily lesser in amount as compared to asymptomatic patients. So asymptomatic children, they don't do anything. They are playful and happy. You wouldn't even think that they have they have ingested batteries or something like that, because it doesn't necessarily cause problems. But some children do. In fact, I've seen acute emergencies with severe drooling, with severe bouts of coughing, incessant coughing, a lot of flushing of the head, and sometimes chest pain, intractable chest pain, sometimes repeated vomits. They're trying to get the foreign body out. So they might, or sometimes even rarely, I have seen a couple of children coming in utter shock, actually, possibly from bleeding inside or whatever. So it is pretty, it's very dubious, but there's a wide range of things, how the way the children do present. And once they're present in the sort of the emergency, and when even there's a slightest suspicion whether it is authenticated or not, that it could be an ingestion, the first thing is, as with all emergencies, is the pertaining to the airway, breathing and circulation, the ABC of practice. So we must make sure, number one, is this child serious enough to need resuscitation? Number one. Number two, to calm the parents really, and just try to evaluate the efficacy of breathing, because that's the most important. We got to rule out whether the foreign body, if at all, is there, whether it is lodged in the chest or whether it has gone into the tummy. If it has lodged inside the chest or gone into the windpipe, then it might be catastrophic. So we shout for help, get the relevant people involved with the help of this 99 and the blue line and all that. So we get that done, and once it is done, and if you're sure that it's not that, we do a few investigations, the basic. Once the stabilization has been done and we are sure that the child is comfortable, we go in and do a few investigations. Number one, we do a chest x-ray, a neck x-ray, and including an abdominal x-ray, which is important. We have to take sort of AP views and lateral views just to, to localize the site where the foreign body could have. But we must remember, there are certain foreign bodies which are radio opaque, which will be picked up by the X-ray, and the others will not be. So once we have done that, then our desperate, we come to your service, we ask you, we try to get you involved and make sure at the same time that the child is well, being monitored properly with the help of all the apparatus that we have in the emergency.
Right.
That's a predominant way.
As Dr. Datta rightly said, that first is that establishing whether the child is sick or not, to establish whether it's in the foreign body, is the airway, or it is in the food pipe or esophagus or some other parts of the intestine. So a foreign body in the airway is not our topic of discussion, because that's an emergency which should be dealt with much vigilance and as an acute emergency. So once it's a foreign body, we ensure that it's in the GI tract. So whether it's in the esophagus or stomach, or it has crossed the stomach. So a simple X-ray can give us a lot of information, especially if the foreign body is opaque, like a coin or a battery, a button battery or a magnet, or even some metal pieces, like as we were mentioning, then sharp objects also we come across, like a screw or a knife, or not a knife, but a blade, a broken blade, even a safety pin can come across. We have come across foreign bodies like safety pin, and even a whole gold chain, which the mother was sleeping and the child just engulfed and put the whole chain into his system, that is a GI system. So after ensuring the foreign body, we decide whether it is within the range of the endoscopy. So once it has crossed the duodenum, the stomach, or it has come into the pelvis, so we can wait and watch, especially if it is a blunt object. But except if it is a multiple magnet. So again, if it's a multiple magnet which has crossed beyond the range of the endoscopic range, that where we cannot reach there by the endoscopy, then we usually call a surgeon for the intervention, because double magnets can be entangled in two layers of the intestine and can lead to a perforation, and because they will not move like other foreign body. Now for a coin, if it is in the throat pipe or the esophagus, we just make arrangement in our endoscopic suite. We call the anesthetist and we directly go for a procedure, once ensuring the child has the anesthetic requirements, that is keeping him in PO, etc. And if it is a magnet, again the same protocol we follow. And for a battery, obviously it's a very different scenario. It's a different ball game. So where we usually keep the surgeon also in our picture if it is more than 4 hours and still in the esophagus. So once removing the foreign body can lead to leak in the esophagus. So where we can need a surgeon also for the next part of the management. But if it has crossed the esophagus and it's in the stomach, and when we go through the endoscopy, there is not much damage to the food pipe, so we can ensure it by using our gadgets like Roth baskets and foreign body forceps, and we can just take it out without much difficulty, and with a very smooth hospital stay or a very short hospital stay for the child. So there are numerous foreign bodies which we come across, like even sharpeners and pencil, the pencil ends, the earrings, then hair clips. So these we have in our, in our museum or stock, that whatever. So these are usually the foreign body which we find in a child, and obviously sharp objects we have to delete. We need a over tube to ensure that it does not cause trauma to the gut. But once it is within the stomach, or at least in the first part or second part of the duodenum, we can do an endoscopic removal.
I think one of there's few important things we should actually think of. Number one is, we need to have a very high index of suspicion.
Yes, sir.
That the foreign body might be presenting. A child who is continuously drooling, or child is coughing, a lot, persistent pain in the upper part of the chest. And these are the things which are sinister, actually.
Mm-hmm.
So that's number one. Number two is, we need to appreciate that button batteries are high risk. And magnets, of course. Number three, which is very important, is, we always need to be absolutely have a good, surveillance atmosphere in the house. So the parents need to be educated, and they need to understand that what are the things that should be kept away from children. That's very important. Storage of batteries, storage of those things, and different fragmented parts of the, loose parts of the, toys that they play. These are important, and they attract a lot of attention. So those things are important, but the parents have a role here. And lastly, which I think is, we always need units such as ours, which is equipped with radiology. Radiology has to be, it's a crucial part of the diagnosis. So you have to be there. And we need people and professionals like you who are adept and expert in, taking, but remember, one of the things is that the delay in diagnosis contributes to the greater morbidity and even mortality in rare cases. So, early diagnosis, rapid referral to you, do radiological investigations as necessary, and getting people like you round the corner to help us 24 hours.
Yes.
That can also.
So as Sir said, as Dr. Datta said, that diagnosis and over-diagnosis and over-vigilance, that is also not required. So if it's a plastic foreign body, a round small ball, or just a rubber cap or an eraser, so we may not be panicky. Usually these are not picked up by the X-ray. If the mother is very categorical that it's a plastic foreign body, and the airway is proper, we can ensure that this will pass away in the stool within next 48 to 72 hours, and so may not require an endoscopy. That's not indicated. But in case if the mother cannot locate it, and if the size of the foreign body is large, then we can suspect that whether still it is in the stomach or the pylorus. So we can, in that case, we can do an ultrasound. Ultrasound, as per literature, can detect a hollow foreign body, which X-ray may not detect, as it's not radio opaque. So we can use some other modalities of investigation which are also less invasive, and then we can plan accordingly. So certain foreign bodies like small feather pieces, very small piece of plastic, they do not require any intervention at all, and usually they pass out. We just ask the mother, because there is a lot of parental anxiety, that please observe the stool properly. Each time the child passes stool, please observe or use a sieve so that you can just locate the foreign body, and that relieves the household tension, both from the parents, the grandparents, etc., and also from to some extent the child.
So we have come to this sort of end of this discussion, but the take-home message is, number one, we have to be careful with our sweet little children, and we have to make sure that their toys are well protected, especially the batteries that we talk about. They have to be, in such a way they are inaccessible for the children, and also other small bits and pieces of the toys. We need to actually supervise our children. If we have the slightest, thoughts that it could be a foreign body, it's better to come to the emergency of a hospital or show a doctor as urgently as possible. Most of the foreign bodies actually will pass off in the stool, but you can't wait. So it's better that it's, you should be availing services of institutes, especially multi-speciality institutes such as us, so where we can investigate immediately and also take the necessary steps which are necessary. Thank you so much. If you have any questions, please do ring us again or talk to us, and we are happy there to serve you. Thank you.